Welcome to another episode of Sisterhood of the Scalpel. I'm Dr. Maryam Zamani.
And I'm Dr. Julie Khanna.
And you guys may notice that we both have a little bit of that summer glow about us because we've been, like many of you, enjoying this summer, finally coming out of lockdowns, wanting to go away, travel, see your friends, families, always in a safe manner, but doing that. But so we want to talk today about—
Wait, you have to say why we were traveling. Congratulations, Dr. Zamani. She got married in beautiful Italy. So a lot of this flow from both of us is from that, and it was amazing. So congratulations to you
Thank
and
you.
Shola, and lots
Thank
of love from
you.
everybody.
Thank you. Thank you. So we know how important it is for everyone this summer to really make sure that they have the time to get out there and enjoy after really not being able to do much of what we've wanted for the past 2 years. But does that mean that you can't have any of the procedures, any of the surgeries that maybe you've been looking forward to for a long time? Absolutely not. So today, Dr. Khanna and I are here to talk to you about our top 3 picks for procedures that you can still have this summer that can leave you feeling refreshed, refined, a bit rejuvenated, and just feeling your best self, but still have a short enough recovery that doesn't take away from your ability to enjoy the summer.
Right.
So, our number 1 pick for this procedure is actually submental liposuction, or liposuction under the chin to just really enhance your jawline.
I feel like I needed a drum roll. Number 1 pick is, okay, go.
This is a procedure that we do with the patient awake, a little bit of local freezing. We do have laughing gas as always available to you to make you feel extra comfortable if you need to. The little bits of scars that you see are practically invisible. They're pinpoint, less than 5 millimeters, hidden in the earlobe area and one under the chin area. That's all the scarring you have. You come in, we help you contour your jawline, and I would say that the swelling and bruising doesn't last really any more than a week. Beyond that, it's at a point where it's barely perceptible, something that you can definitely cover up with a touch of concealer if you even need it. And you start to be able to enjoy that beautiful jawline contour after 2 weeks or so. So that's my number 1 pick for the procedure that I would recommend.
And it makes such a change, right? Like
It does.
and it's not something that people are going to notice in sense of, oh, you had surgery. They're just going to look at you and go, wow, you look really good. Did you lose weight? Did something change? They'll notice a change, that for
Mhm.
sure. And they'll notice that change at a week, because even though
Exactly.
there's a little bit of swelling, it's overall looks better than
Than
pre.
before.
So it's a good one. I agree. That's definitely our number 1 pick.
That's my number 1 pick for the summer. My number 2 pick for the summer is for some of our patients that are feeling that their eyelids are starting to get a little bit heavy. You're struggling to put on your little cat eyeliner, your eyeshadow, just feeling like your eyes are just betraying how bright and alive you feel inside, and you want to get a little bit more of that refreshment. So, an upper eyelid surgery is a perfect procedure for that. And all that involves is, again, a procedure we do with you awake, just a touch of freezing. It is not painful whatsoever. Laughing gas is always available. And all we're doing is taking away a little pinch of skin, sometimes a touch of fat away, what makes that kind of hooded look, that heaviness in the upper eyelid. Within a week, again, you come back, any sutures that need to be removed are removed. By then, you're starting to feel really good, looking really good. You might have a touch of bruising around the eyes, but then again, this is something that by 10 days, you're definitely able to cover up some concealer. And it's the summertime, we're all wearing sunglasses anyway.
Those big Prada sunglasses, the big ones,
Exactly.
you won't see a thing.
Go Jackie O on this procedure.
They go big,
And
Jackie O.
And it really, the effects are instantaneous. So you really do see that improvement. And as always, this is something that doesn't make you look totally different. You look like yourself, but everyone will ask you, did you just come back from a spa? How was your vacation? Because you just look brighter and happier and more refreshed. So that's my number 2 pick for the procedure. So Dr. Khanna, we've just been talking about procedures that are under local freezing and on the smaller side, but we do have another popular procedure that we do that is great for the summer and might be on a lot of people's minds.
And I think this procedure, people are going to be surprised that we're saying it's a summer procedure, because they think of it, oh, I can't do it in the summer. And that's breast augmentation. So breast augmentation for us is a rapid recovery 1 week procedure that you need maybe a week off, if that. We do a rapid recovery. The next day, you're out. You're out and about. Yeah, you feel a little fuller, you feel a little tight, but that's kind of looks nice in the summer. It settles down after a few weeks, but in a bikini, it looks great. And
Fantastic.
bruising, usually you get a worse bruise with your IV than you get in the entire breast augmentation. And in terms of being in the pool and getting in the lake, you're looking at 2 to 3 weeks. You can be in the pool, you can be in the lake, everything's healed. It's a small 4.5 centimeter incision underneath the crease. People are always like, that's it? They come back at their week appointment, they're like, I didn't take any medication. Like, that's why we didn't give you any. Like, Tylenol should be enough. And they're like, yeah, but it was easy. And the funny thing about that, and really the most important thing about that, is the rapid recovery is not just about rapid recovery, but it's also about long-term result. That it's been proven to have a better capsular contracture rate, a better, lower overall result complication rate when you have that efficient, not quick, but meticulous surgery that makes recovery like that.
This is something we're excited about because people always think, oh, I didn't get it in time for the summer. Now it's gone. Now I have to think about.
I have to wait. Yeah.
Always call us. We always have a solution that can meet the needs that you have for this moment to make you feel your absolutely best self.
And sometimes it's starting with products or getting yourself primed for that procedure that you want in the fall. And, we have so many things that we can help. If you're going to do a facelift, let's get your face glowing. Let's get you on your products. Let's make sure we're doing our Botox, and all of those little things can make it a better operation.
And as always, if you have any questions, any ideas, anything you want us to talk about on Sisterhood the Scalpel, make sure you're subscribed, make sure you follow us in all the different formats. I'm not really sure where I'm always supposed to point, but do so, and we're always here. We're happy to talk to you in person or virtually. We're always here.
And wear your sunscreen, be safe, and enjoy the summer.
Happy summer, everyone. This is Dr. Zamani.
This is Dr. Julie Khanna.
And thank you for tuning in to Sisterhood of the Scalpel. Make sure you stay tuned for our next episode. Bye.
Bye, guys.